Essentially, when you are going to address any vulnerability or any component of vulnerability within a community, you absolutely have to plan, strategize, resource based on facts. You need to know how many social workers you need to know how you're going to address underlying causalities for separation of families. If you don't have the data, you can't even begin, in my opinion, to develop those policies and those strategies, those well thought through processes that you need to produce in order to both prevent and separation and provide really suitable alternative forms of care if you don't have the data. So it's really essential also not just look at the quantitative data, but to address within that the reasons children are coming into care, how long children stay in care, their journey through the care experience, and what happens to them after they leave care. And very much we found a huge lack of information on the outcomes for children who have gone through a care experience. So working with national statistical bureaus or organisations is absolutely essential to inform not just the ministries, say for social protection or child welfare, but also for health, education, housing, all the multi-sectoral approach that is needed to address the vulnerabilities of children and families, and making sure they have the right statistics and data on which to really effectively, efficiently plan, but also implement. We felt more than anything that it's so important to listen to the voices of children and young people who have care experience. They're really the ones who can truly inform us about what works, what doesn't work, what the challenges, and what is the impact on their individual lives. However, we also wanted to develop a methodology that was ethically sound and that did not impinge on anything that they didn't want to tell us, or to create an environment in which they could provide us with information but in fact maybe didn't actually have to vocalize it. So we developed a method where collectively they could draw the care process. So they would draw a process of where they live, in formal care or some form of alternative care, and then pathways into care and pathways out of care if they were relevant. And on each of those moments coming into care, in care and leaving care, we placed something called happy and worry bags. And the children were given pieces of paper and they could anonymously and quite privately write key words that expressed what was a worry to them, what concerned them, and actually was a positive. And so they could do that without anyone else seeing what they were actually placing in those worry bags, and then we took that information and analysed that. So we developed a methodology where they could openly express information if they wanted to, but we also felt that care experience can be very private and also a very unsettling thing to talk about. So we wanted to develop a methodology that was also suitable for all ages and all forms of care. Where we found there were issues of concerns, we had already put a child protection policy in place as to how we would respond to those issues. So obviously we didn't necessarily know the individual child, but we did know where that child was situated. So in each country we made sure there was a process where we could go back to someone within the national system who could then address those concerns. So we definitely were very careful to be ethical about the entire process. When we were actually doing the group activity, although they weren't present because we wanted the children to be able to express themselves freely, we did also make sure that there was someone on hand who, if there had been any sort of emotional upset due to the process, they would also work with the children afterwards, who the children knew. So the children knew and trusted that person.